But our backlog is also there. We are trying to overcome the backlog. We have got a backlog of nearly about 3,000 tests per day, and the backlog of 3,000 tests at the moment. The reason the backlog is because more and more people are testing, and we are also doing contact tracing, and all these things put together, the backlog is there. We need to be, like what the Chief Minister said, at 5,000. If we are at 5,000, cases also are going to be more proportionately, more beds will be required. Ponda Hospital, I have already put on note that ESIC Hospital to be a COVID hospital, South Goa District Hospital to be a COVID hospital. Shiroda CMS said that will be a COVID care center. Shamakpura Krishna Stadium we have taken, and Ponda Hospital will be a COVID hospital. So with this, I think our teams will be in place. We want more doctors also. I have told the Dean, and I am telling in direct and details, both in presence of the media, whatever the requirement is to put to the government so that we can get more and more resources to help our existing set of doctors that are there. And it is very important for us to understand that in the state of Goa, we are one of the only states where I told you last time also that IL-6, D-dimer and all other protocols, I have told them, I have given the written protocols in place. Do it as much as per the protocol. Every 72 hours they are supposed to repeat this test so that they are able to overcome the cytokine storm. And in order to overcome the cytokine storm, you need the best of labs to be made available in the hospital so that they are able to accordingly diagnose what is the manner in which they can deal with that patient. Patient to patient it varies. And also the volume of oxygen is going up every day. So if we say that today we have got X number of oxygen in terms of whatever that measurement that they say is available in the state of Goa, I don't think that will be the figure till tomorrow. There will be a different figure tomorrow. And people of Goa need to understand, young generation needs to understand, is stop partying, stay at home. This is not the time for you to party. This is a serious situation in the state, in the country. Clubs, we see that people are without face masks, without masks, nothing, everybody jumping around the place. Action should be taken against such clubs. Because today I speak as a very passionately as the Health Minister of the state of Goa, because the load is increasing on the health sector, load is increasing on the doctors, and parents of these young children and young parents must try to keep their children in the house rather than send them for parties. Every weekend we see on the beach, in Morchim and in many other areas, it seems to be a free-flow party everywhere. And as a result, this is affecting more people. Infectivity is increasing. This virus, as we have already said, is an infective virus. It is infecting more compared to last year. And as a result, we all must take care.